This is clavicle. It is the only long bone in the body that lies horizontally. Since it's a long bone, so naturally it is supposed to have two ends and an intervening shaft. Always for a bone, a student needs to understand these um, headings or terms related with a bone. In order to hold the bone in its correct position, a student is supposed to know its anatomical position. And if that bone is present in the body in pairs, then a student is supposed to know about the bone to which side it belongs. It either belongs to right side or left side. Then bony features, gross features or landmarks, which means that there are certain features present on the surface of the bone itself, which include some depressions, small foramina, grooves, elevations, elevations of variable sizes from small to larger sizes. So a student is supposed to know all those features, and those features are labeled as bony features, gross features, or simply as bony landmarks. Then we have attachments. A bone is supposed to have certain structures getting attached over it, which include the muscles of that region and ligaments. Ossification refers to the development of the bone. So in ossification, a student is supposed to know when do the primary centers for that bone appear, and when do the secondary centers appear, and when the ossification centers, at what age do these ossification centers fuse to completely ossify the bone. Then we have clinicals, any fractures, pathologies, either congenital or acquired pathologies. A student is supposed to know all those clinicals related with that bone. The ends are labeled as a medial end and a lateral end. You can see the difference in the shapes and sizes of these two ends. The medial end is almost cylindrical or quadrangular in shape, whereas the lateral end is flat from above downwards. Clavicle at these two ends forms two important joints. At the medial end, clavicle articulates with the manubrium of the sternum to form a joint called sternoclavicular joint. Whereas on the acromial end or the lateral end, the clavicle joins with the acromion process of scapula to form the acromioclavicular joint. The shaft of clavicle is divided into two parts, a medial 2/3 and a lateral 1/3. The medial 2/3 is cylindrical in shape, whereas the lateral 1/3, just like the lateral end, is flattened. So that the medial 2/3 has four surfaces and the lateral 1/3 has two surfaces and two borders. Medial 2/3 has no borders, rather only four surfaces, which are named as a superior surface, an anterior surface, inferior surface, and a posterior surface. So this is the superior surface of the clavicle. Whereas lateral one-third of the clavicle has two borders and two surfaces. The borders include an anterior border and a posterior border. And two surfaces. This one is the inferior surface, and this one, again, just like the medial two-third, is the superior surface. Also, please notice the curves in the medial two-thirds and the lateral one-third. The convexity in the medial two-thirds is directed forwards or anteriorly, whereas in lateral one-third, the concavity faces forward. What are the different bony features or landmarks that are present on the medial two-thirds and lateral one-third of the shaft? On the anterior surface and superior surface, where the muscles are attached and ligaments of the respective joints are attached, those areas are roughened. Rest of the areas on those surfaces are smooth. Same is the case with posterior surface. However, there are certain landmarks on the inferior surface of both medial two-third and lateral one-third. On the medial two-third, near the sternal end or the medial end is an oval roughened area that is there to provide attachment to a ligament called costoclavicular ligament. Next to this roughened area, towards the moving laterally, there is a narrow, long depression called a sulcus or groove. This sulcus or groove is named according to the muscle to which it provides attachment, and the name of the groove or sulcus is subclavian groove or subclavian sulcus. Further moving on laterally over the inferior surface of the lateral one-third of the clavicle is the small rounded elevation near the posterior border of the lateral one-third, and this rounded elevation is known as conoid tubercle. Anterior and towards the lateral end of the clavicle and anterior to conoid tubercle is a roughened, long, raised line or ridge, which is known as trapezoid line or ridge. These two landmarks are named according to the attachment they provide. They provide attachment to a very important ligament of the body, which is known as coracoclavicular ligament, which has two parts, a trapezoid part and a conoid part. From here, we move on to the attachments on clavicle. In this diagram, you can see the superior surface of the clavicle in whole, and this is the inferior surface of clavicle. This is again the medial end of the clavicle, and this is the lateral end of the clavicle. Over the superior surface of medial two-thirds of clavicle, near the sternal end, gets attached sternocleidomastoid muscle. Over the anterior surface of the clavicle, so medial two-thirds, pectoralis major muscle gets attached. Over the lateral one-third anterior border, deltoid takes origin, and on the posterior border of the lateral one-third of clavicle, trapezius is inserted. turning the bone so that we are looking over the inferior surface of the clavicle. The muscle that attaches over the posterior surface near the inferior and posterior surface of the clavicle is a muscle of the neck called sternohyoid muscle. And we have just seen bony features over the inferior surface of medial two-thirds of clavicle, where an oval elevation, oval roughened impression was present, and here costoclavicular ligament gets attached. Next, at the junction of the medial two-thirds and inferior one-third, over the inferior surface of the clavicle, a groove or sulcus was present called the subclavian groove or subclavian sulcus. The floor of the sulcus provides attachment to the muscle of the same name, that is subclavius muscle, whereas the margins of the subclavian groove provide attachment to the fascia of anterior of the pectoral region known as clavipectoral fascia. Further moving on over the inferior surface of the lateral one-third of clavicle, we had seen previously in the bony features a conoid tubercle and trapezoid ridge. Conoid tubercle and trapezoid ridge provide attachment to the conoid and trapezoid parts of the coracoclavicular ligament, respectively. Regarding ossification of clavicle, clavicle ossifies with the help of two primary centers and two secondary centers. The primary centers for the clavicle, they appear in the medial and lateral parts of the shaft of clavicle at about 5th to 6th week of intrauterine life, that is before birth, and they fuse around 45th day of intrauterine life. The secondary centers, they appear one for the sternal end and one for the acromial end. These two centers, they appear roughly about 19 to 20 years of age, and they are fused around 25th year of life after birth. A very famous and very important clinical regarding the clavicle is called green stick fracture. Green stick refers to a branch, a newly arising branch of a tree. This branch is soft in nature, hence, when it is flexed, it doesn't break in its entirety, but rather it bends. Similar is the case with the fracture of the same name of the clavicle. What happens in the green stick fracture of the clavicle is that the clavicle does not divide into two separate segments. Rather, the segments, they remain attached to each other after the fracture, but they show a slight line of fracture at the site of damage, and the bone is bent, just like this branch of a tree. This green stick fracture is common in newborn babies that are of good weight at the time of birth. And at the time of birth, if the birth canal of the mother is narrow and the weight of the baby and size of the baby is more than the size of the birth of the birth canal, so what happens? The baby is delivered on one side, on its one side. So what happens? Due to this disproportionate sizes, one clavicle of the newborn is bent like a green stick, which is shown in this diagram on the left side of the slide. And the clavicle of the other side is properly fractured. Since the clavicle of the infants or in the childhood, children of the younger ages, the clavicle is usually soft since it is still in the developmental process. So this softness is responsible for green stick fracture. Another very important clinical in the adults is simply the fracture of the clavicle, since it is the commonly broken or fractured bone in adults. The causes of fracture may include a direct blow to the clavicle and road traffic accidents. At this point, a student must know that what is the weakest point of clavicle. The weak point of clavicle is considered to be the junction where the medial two-thirds of the shaft of clavicle joins the lateral one-third of the shaft of the clavicle. This is the weak area or weak point. This bend is the weak point of clavicle. When in the adults, the direct blow or as a result of severe road traffic accidents, if the damage to the clavicle is severe, such extensive damage and fracture of clavicle may lead to very important pathology that may arise as a result of damage to neurovasculature that is passing under the clavicle, deep to clavicle, from neck to upper arm. And the structures that are passing between neck and the upper arm below the clavicle or deep to clavicle include subclavian artery and subclavian vein and brachial plexus. If the subclavian artery and vein they get damaged, the arm of that side may lose its blood supply. And in case of damage to brachial plexus, the sensations, including both sensory and motor, they can be lost again of the arm on the damaged side.